is the DEXA scan? It is a dual energy X-ray absorptiometry, meaning it's an X-ray. It X-rays usually your lumbar spine, which is your lower spine here, and usually we X-ray your hips. If you had your hips replaced, usually we do your radius and ulna right here. And what it's doing is trying to find your bone density. And that means how strong are your bones. So we don't want them to start breaking down, becoming brittle, and getting that osteoporosis, where it's easier to fracture a bone or break a bone. So that's what we're looking for so that we can prevent it. As we age, you know, when we're young, we need to be eating a lot of vitamin D, lots of calcium in our diet, because that's when we're building the most bone mass in our bodies. So once we hit about 30, you start slowly losing your bone mass. You do not gain any more. So like I said, when we're younger, we need to really gain it. Once you hit 30, you start losing it. Once you hit menopause, sadly, it just is a real quick decline of your bone mass. And so it's just your bones become weaker, you lose that calcium and that vitamin D, and you're more likely to get that osteoporosis or bone breakdown. So what we have, I have a picture here. So a normal bone looks like this. It's very strong, that matrix. You can barely see through it if you would fall. There's a lot of compression that's available in that matrix to be very strong and prevent it from breaking. And then we have osteopenia, which would be it's starting to get into this range, or starting to lose some of this matrix. And then you have osteoporosis, where you can see that matrix is not very strong. You can see through it. It's very weak in the fact that you can easily break a bone with that type of bone stability. I have some other handheld devices if you want to look at them there too. So that's kind of how we transition. So who needs a DEXA scan? Usually we do it at the age of 65, postmenopausal women. We usually repeat it every 2 years, but I'll kind of go further into that in a little bit. Do men need a DEXA scan? Because it seems like we always have to get everything. I just feel like that. But we don't usually screen men for a bone density looking for osteoporosis unless they're over the age of 70. They've lost like 1.5 inches of their height. So they're starting to kind of curve over. If they've been on like prostate medications that cause them to have steroids, that would be an increased risk. Or if they already broken a bone. So it was like a really minor injury, you know, that shouldn't have broken that bone. Then we would proceed with a DEXA scan on a guy. Postmenopausal women that are younger than 65 with some clinical risk factors also need a DEXA scan. So this would include, if you have some of these risk factors, then you're going to need a bone density scan earlier than that age. The biggest thing is people breaking bones as adults. Not maybe like in a motor vehicle accident, but they fell and they broke their bone. And they're not even 65 yet. That would qualify you for a DEXA scan early. Another big thing is people taking steroids or glucocorticoids all the time. Not just here and there, but all the time, because they break down your bone density or your bone mass. So people with rheumatoid arthritis, that's one of their main treatments for it, especially for flare-ups. So they're at an increased risk of it. If you're really skinny, you're less than 127 pounds, you'd be qualifying. Also, genetically, if your mom or dad, you know, broke their hip, or they had a lot of genetic factors, of osteoporosis, you will probably have those too. So being cognizant and aware of that, you may need a DEXA scan earlier as well. Cigarette smoking, alcohol intake, those definitely have increased risk of bone breakdown. And then you have your race and ethnicity. White people are just significantly more prone to getting osteoporosis or that osteopenia. How do you get a DEXA scan? It's pretty easy. It's one of the easiest tests we have. You just come, you sit on the table, then like I said, they x-ray your lumbar spine and they x-ray your hips. So easy peasy, it just goes over you and it does that. And sometimes they'll have to do your wrist if you've had your hips replaced. But then they bring you back to the room and then we talk about your score. So this can get complicated, but what this means is you see your 3 ranges. You got your normal, that means you have great bone density. No worries, we're just going to continue watching you in the next 10 years. You probably won't have to repeat this DEXA scan unless you have some risk factors for 10 years. So that's great. say you're starting to get this yellow spot, it's like, oh, we're starting to get a little bit of bone breakdown. That's a warning flag. We need to start making changes. And then you have the red section, which is your osteoporosis, so your bone breakdown. This is definitely needing treatment, and you will get a repeat DEXA scan about every 2 years with that. Now say we have a T-score, and that's the score we go off of. And that's a score comparing you to a 30-year-old person of the same sex. The Z-score is your score compared to somebody else of the exact same age. So what we look at these scores, we actually compare you to the 30-year-old, because that's where your bone mass should have been the strongest. So, like I said, the scores, like -1 is when you're starting to get into the bone breakdown, and -2.5, that's when you start getting osteoporosis. So, that's kind of those levels. Okay, we also do a FRAX score, and this is a fracture risk assessment tool, and usually it's at the end. This is when I will ask you those questions. Do you drink a lot of alcohol? Are you on steroids? Do you have rheumatoid arthritis? Do you have irritable bowel disease? Those types of things. If you answer yes to any of those, we calculate your risk in the next 10 years of having a fracture. Okay, it's just a probability. If you are at high risk, if you have a score for a hip fracture that's greater than 3, you need to start medications, or you have the chance, in the next 10 years, you have a chance of having a major fracture, whether it be a hip, your back, your radius, ulna, anything like that, at 20%. So those numbers we look at, and if those are high, but you're still kind of in this, well, if that number is high and you're still in this score, we still recommend treatment. It also allows us to get medications covered by insurance sometimes better as well. So how do we prevent you from getting osteoporosis? It's imperative as we're young to teach your kids to mainly give lots of vitamin D, lots of calcium in their diet before they're 30. Next, don't smoke. Try to limit your alcohol intake. The other thing is weight-bearing activities. So your bones, well, your muscles are connected to your bones. So if you work out your muscles, if you strengthen your muscles, they're going to make your bones stronger. That's going to decrease your risk of breaking a bone. So if you can't lift weights, that's fine. But if you can get in the pool, that resistance in the pool will definitely build up some muscle mass as well. So, or even if you just like to walk, if you could go with a little bit more weight to help you build up some of that muscle mass, it will help. So, also consuming at least 1,200 milligrams of calcium per day with adequate vitamin D intake. This should be for everybody pretty much. There are supplements that you can take over the counter. My thing with those are they're fine, and some people have to be on them, and they're great things. But you also want to try to incorporate some dairy or some calcium-rich food in your diet. And the thing is that when you want to take that dietary supplement with food, which is great. But say you had a glass of milk and you took your dietary supplement of that calcium. You only absorb one of them, you pee out the rest. So you wasted one of them. So if you could have like a glass of milk at breakfast, a stick of cheese, at lunch, thing of yogurt, and then maybe at supper take your calcium supplement, you'll get the benefit of all that absorption throughout the day. You cannot absorb calcium unless you have vitamin D. That's usually why they're together. So this is just some things. Some people hate dairy. I get that. My mom's one of them. She's broken a lot of bones from it. But like orange juice has some, and soy milk, beans, green leafy veggies, almonds. There are other things out there with calcium, so you can try those as well in your diet, as well as a supplementation if needed. Treatments. Our treatments are geared to decreasing bone loss, and if we can't gain bone mass back, at least we can keep it at a stable level so it's not deteriorating through the years. That's what we're working on. Certain medications, I won't go too far into it, but our number one treatment is usually bisphosphonates. It's a pill that you take once a week. Some people have a hard time getting it down because you got to stay upright for 30 minutes. It can cause massive reflux and things like that. Also, if you have really bad kidneys, we don't recommend that medication. But that is our first line drug. People are usually on that drug for about 5 years. After about 5 years, you need to talk to your doctor again because you're at an increased risk of fracture again. There are studies out there that if you are on it for longer than that, you're at an increased risk. It's still rare, but if we can get you off that medication and try something else, it'll be more beneficial for it. So another one that they don't use too much anymore is Forteo. It's a parathyroid hormone, and you have to inject it every day. Most people do not want to inject something every day. I mean, diabetics have it bad enough. Why add this on top of it? One thing we're using a lot, and Medicare is paying for it, so we use it, is the monoclonal antibody called Prolia. It's an injection that you get every 6 months. I mean, it's very simple. There are side effects to all these medications, but a lot of the females that I've had on it, they've done okay with, and it's done actually really well for their bone density scans. It's actually gone up. It's improving that. So, I mean, that would be something, and like I said, Medicare covers it, so it's a good option for a lot of people. But only twice a year. Twice a year is not bad. So, hormone replacement therapy, it has pros and cons, which means taking estrogen and progesterone, those types of things, after you after you're in menopause or after. Estrogen in itself helps us build muscle mass up. So if you take a hormone replacement therapy, one of the benefits of it is that it keeps your bones stronger, longer, decreases your risk of osteoporosis. So that's one good thing about it. There's also a lot of other things, so definitely talk to your doctor about that. But these are my sources. Anybody have any questions? Yes.
Okay, so I have a bone density scheduled in October in Lincoln, but I have to go off my multivitamin with calcium in it prior to the test. So that's just so it doesn't skew anything. And
I've never heard of that, but I could see them doing that, probably because they just want a baseline to see where you're at with it. So, but no, I don't have people stop anything, so I want to know where they're at right then and there, so. And if that's the supplementation you're taking, then I want to know how it's working for you, so. And I wouldn't think, I don't know, I'd have to look further into that. I don't know how it would skew anything, because it's just an x-ray right then and there of what it is, what your bone density is right then and there. They do recommend that you get your bone density scan taken at the same place, because each machine is different, so you're going to have variability. So if you can get it at the same place every time you do it, you'll be better off with that. You'll get more consistent scores. I do know that. Any other? Yeah.
So is it possible, I know you just get rid of the extra calcium, but is it bad to take more calcium than what you should?
Sometimes it is, yes, it can be. It just depends on how much you're taking, how good your kidney function is. I mean, the younger we are, the more our kidneys can tolerate. I mean, if you have more of a poorer kidney function or your kidney function starting to decline, then you definitely want to watch all your vitamins and minerals because they're probably filtered through the kidneys and sometimes it can just burn them. So, not usually, no. Any other questions? Thank you, ladies. Please get your desks.
is there one more? I don't think so. Oh, that was it. Oh, it's in the gym? Okay.
Oh, really? Yeah, I never.
Take one. Yeah. What?
So I'm gonna have to sign for you, okay.
Yeah.
And they have me, they have me come in that Monday, you need to get this. So that's your. It was on.
Right.
It was on the chair.
So I'm gonna do that.
Oh, one of the students, yes.
Yeah, it wasn't the one I wanted to do. That was enough for me.
I'm sure, I'm sure. I don't know what they told you last year, like, I don't even know what they do, I can't I don't know, I have to look at what they did, that's interesting. No, I mean, you're on your supplements and you do really well, and like you said, you walk all the time, so.